and I'm the Quality and Business Services Manager at Lextox, so I'll be talking through today's presentation. The event will be recorded, and this will be shared with a number of people who couldn't make today's event, unfortunately. Okay, just experiencing a few technical difficulties at the moment. So Sammy, your client manager, is on the call, but we haven't been able to get her as a presenter this morning. So if Sammy's got any question, would like to chip in, then take yourself off mute or put something in the chat, please. So everybody has been set to mute. So if you do have any questions, please use the chat facility. That's just so that everybody can hear today's presentation without any disruption or background noise. All attendees will be taken off mute at the end of the session. So if you do have any questions, there's an opportunity to ask them at the end as well. So today's session should really last only an hour. And hopefully it will give you a good insight into hair, drug and alcohol testing and give you some knowledge so that you can use that in your casework. So today's session, start with an introduction. So hopefully Sammy will be able to speak at that point and go through a little bit about Lextox. Hopefully you know about us, so the introduction shouldn't be too lengthy. Then I'll talk through hair drug testing. So I'll talk through the drug testing aspect first of all, and then I'll move on to the alcohol testing because they're very two different types of tests. Then I'll go through other services that we offer, so blood testing for alcohol markers, SCRAM, continuous alcohol testing, which is a useful way of monitoring alcohol consumption, and then just go through some information about sample collections and reporting results. And as I said, feel free to put any questions into the chat, and all delegates will be taken off mute at the end, and then you'll be free to ask any questions at that point. Okay, so we'll just see if Sammy can take herself off mute to talk through this section. No, I don't think that's possible. So so I'll go through this.
Hello, can everybody hear me?
Yes, we can, Sammy. Great.
Okay, great. I'm not sure how to put my video on for some reason. It's not giving me permission to do that, so apologies for that. But yes, I am Sammy. I am the client manager for the North Wales region. So all of the solicitors here will have heard my voice. I was hoping you could see my face for once, but I'm sorry about that, technical difficulties. But yes, when we undertake our testing here, I am your main point of contact. So I will assist you on your cases from start to finish. You can come to me for initial pricing when you have your court orders and you wish to proceed with formal quotations. I'm happy to arrange your sample collection appointments. I'm happy to call your clients directly and arrange with them to save you the hassle. Or I can arrange with yourselves at your offices, whatever's best for yourselves. I'm more than happy to do whatever makes your lives easier for yourselves. You can call me through our standard contact line, or you can pop me an email at any time, and I'm always available Monday to Friday between 9 and 5 o'clock. There's lots of ranges of testing that we undertake, which Liam will go through with yourselves a bit later on. We do have the online referral forms. We also have the online portal, which you can log in to your account and you can see all of your cases in one place. And we also have our standard PDFs as well. You're always welcome to send me a court order directly, and I'm more than happy to arrange the formal quotation for you, whatever, as I said before, is easiest for yourselves. We can book appointments within 24 to 48 hours. Sometimes I can also do same-day collections, just depends on my collector and your client's availability, but I'm always on hand to get things rushed through as urgently as I can for yourselves. when the sample then arrives into our laboratory, we'll then confirm that with yourselves, and you'll be able to see when the sample is with us and in testing stage. Lextox then, just a little bit about the company. Lextox was established in the UK by experts within the UK industry. We aim to provide you with the most reliable and defensible results. Our clientele is based on the family law cases and within childcare proceedings, and we undertake analysis of hair for drugs and alcohol in accordance with the Society of Hair Testing recommendations. So we always follow their guidelines with any of the testing that we undertake here at Lextox. Our laboratories are an accredited laboratory to the ISO 17025 testing standards for hair, drug and alcohol testing. We are also a UK toxicology lab requirement, which is now for a Lab 51 procedure. So this new method gives a new set of technical requirements that UK-based laboratories need to comply with. And this method now strengthens the quality procedures within the laboratory services. So we are now ISO 17025 and also Lab 51 accredited. We have over 17,000 clients across the UK that we currently work with. And yeah, that's a little bit about Lextox. I'll pass you over to Liam now. He's one of our experts who has over 19 years of experience within the industry. Liam, if I can hand over to you now, please. Thank you very much.
Great, thank you, Sammy. Okay, so I'll talk a bit about the science behind hair testing first of all, and how drugs and alcohol markers get into the hair, and then I'll actually go through the drug testing and the alcohol tests that are available and explain what they can and can't provide. So to begin with then, hair grows at approximately 1 centimetre a month. So this means that a 3 centimetre section of scalp hair will provide a 3-month history of an individual's drug and alcohol use over a period of time. It would be very convenient if everyone's hair did grow at 1 centimetre a month, but it's the average growth rate of the population. So we use the average growth rate so that we can actually provide an approximate time period to that sample of hair. The growth rate can actually vary between 0.6 and 1.4 centimeters a month. However, when we receive a hair sample, we don't know how fast or how slow that individual's hair is actually growing. So we apply the population average to provide that approximate time period. So we can go back as long as the hair allows. For example, a 12 centimeter section of scalp hair will allow us to go back a year, and we can break this down into 3 centimeter sections covering 3 months, or 1 centimeter sections covering individual monthly sections. And the month by month analysis is really useful for providing a trend or a pattern of drug use over a period of time. So the way that a drug gets into the hair is upon ingestion, the drug goes into the bloodstream. So then the bloodstream then transports that drug around the body. And because the drug is present in the blood, every single hair follicle has its own blood supply that feeds it with the nutrients that it needs in order to grow. So because the drug is in the blood, as the hair is growing, it's taking up any drug which is in that in the blood itself and incorporating that into the root of the hair. So as the hair then grows out of the scalp and out of the body, any drug or alcohol marker that was in the blood incorporated into the root is then trapped in that section of hair, and therefore then as the hair grows out, the drug compound stays in that section of hair, which is why we can then correlate it back to an approximate time period. So there's something called the resting phase, which you will need to be aware of, and this is mainly to do with the growth cycle of hair. So particularly in scalp hair, for example, the majority of the hair, about 85% of the scalp hair, is actively growing. So this is picking up recent drug use. But a small proportion is in this resting or non-growing phase. So what this means is that hair will grow for a number of years and then actually stop growing and remain on the scalp for a period of up to about 6 months in this resting or non-growing phase before it is then shed and then replaced by new hair. So when we take a hair sample, a small proportion of this hair is in this resting or non-growing phase. Now, this will contain drugs from an earlier time period. So the significance of this is that if somebody was a regular user of drugs over a period of time and then suddenly stopped, it can take up to 6 months for a completely not detected result, because some of the um, drug use will be present in that small amount of hair correlating back to an earlier time period. So what we'd expect to then see is in the month immediately following drug use, we would expect to see a very sharp decrease in the amount of drug detected following the month of drug use to that month of cessation. So this is where the month by month analysis is really useful, because we can then see that trend or that pattern where somebody has actually stopped using, and we can make a comment on that in the expert report and compare it to the donor's declaration, which is made at the time of the sample collection. So then we can make an interpretation and opinion on whether the donor's declaration is consistent with the pattern of results that we found. Now, there are occasions when an individual may actually remove all of their scalp hair prior to a sample collection to actually try to avoid providing a hair sample, in which case we can analyze, collect and analyze body hair. Body hair is an alternative to scalp hair. It's still as accurate, and we can still detect the drugs and the alcohol markers in the body hair. It's just that body hair is a different growth cycle. So it's the time period is more approximate with a body hair sample than with a scalp hair sample. So with body hair, about 40 to 60% is in this resting or non-growing phase. So therefore, a greater proportion is picking up hair from which has stopped growing from an earlier time. So therefore, we have to take this into account when estimating that time period. So generally, a body hair sample covers between 4 and 18 months. So that does depend on where the body hair is collected and how long the body hair is. So we can't segment body hair into the month by month analysis that we can do with scalp hair. We have to analyze it as an overview sample, as a whole sample, and provide that more approximate time period. Now, with the drug analysis, we can detect drugs or use body hair from anywhere on the body. In respect of alcohol, we can only collect and analyze hair from the chest, forearm, or leg regions. So there is a difference in the types of body hair that can be used between the drug analysis and the alcohol analysis. So the benefits of hair testing is that in a single test, we can cover a long period of time. So we can go back a number of months as opposed to days or weeks that oral fluid analysis can actually provide. And the sectional analysis of scalp hair can really provide a trend or a pattern of drug use from that individual over a period of time. So we can see whether that's increasing, decreasing, intermittent, or we can then relate it back to the donor's declaration of when they actually stopped using drugs to see that rapid decrease in the months following use. The drugs remain locked in the hair for as long as the hair is. So we can go back as long as the hair allows. So the length of the hair that is available is the determining factor on how far back we can actually go. I have received complaints previously that we haven't covered the full 9 months when the individual has got scalp hair, which kind of my length, which would really about 4 or 5 centimeters. So we can only go back as long as the hair is. So the hair is really simple and quick to collect, and it's less invasive than other tests such as blood analysis or urine analysis. So there are some considerations that you need to be aware of with hair testing. So it does take approximately 2 weeks for the hair to grow sufficiently out of the scalp and out of the body for it to be included in the actual analysis. So this is to allow enough time for the drug to go into the body, be incorporated into the root of the hair itself, and then for the hair to grow out of the body or scalp to then be included in that analysis. So the significance of this is that we take 2 weeks off the sample collection date um, to then start the time period of that analysis. So as a practical example, if you wanted to cover the whole of June, for example, we would really need to organise a sample collection towards the middle of July so that we can take off those 2 weeks and then start the analysis time period from the end of June, going back to end of May, um, and so forth. So because of that, it's not appropriate for the detection of recent drug use, i.e. in the past few days or the past few weeks. It really is only looking at the past few months only. And the test is an integrated result for the whole of the time period covered. So because of that, it's looking at any drug use within that whole month, 1 month, or the whole 3-month time period. So it's not possible to determine the specific drug purity, the dose used, or the frequency of use within that 1 month or 3-month period. So it's not possible to say exactly how much drug an individual has used, whether that's 3 grams of cocaine or 4 ecstasy tablets, for example, or how many days within that month or 3-month period, or what days. But what we can state is that the level of drug detected is in a low, medium, or high level, and then look at patterns to help build a picture around the level of drug use that we've detected. And a one-off use may go undetected with the test, and that's because the cutoff levels that we apply are there to show the repeated use of that drug. So a single use within the 1 month or 3-month use time period is very, very, very likely to go undetected. And that's because with a one-off use, the amount of drug ingested is very, very small. So we are looking, and the test is there to show the repeated use of that drug over a period of time. So this slide is there to give an indication of the compounds that we can detect in hair. I'm not going to go through every single drug group, but what I will say at this point is that the test that we do is very sensitive and specific. So if we find that particular drug in the hair, then it can only be that drug and it can't be anything else. For example, cocaine. If we find cocaine in the hair, it can only be cocaine and it can't be any other compound. As an example, we often get asked whether benzocaine can give a positive result for cocaine and whether that can actually explain the positive cocaine result. So benzocaine is often administered during dental procedures. Benzocaine, whilst it might sound like cocaine and whilst it might sound like the cocaine metabolite, which is benzolecithine, it's not cocaine and it would not give a positive result for cocaine. Okay. With the opiates drug group, we can tell the difference between the legal heroin use, and we look for a marker specifically for heroin use, which is 6-acetylmorphine. But we also can tell the difference between the heroin use and the legal forms, such as codeine, dihydrocodeine. So, we automatically look for those within the opiates drug group. Now, when we undertake the test, we look for the parent drug, and in many of the drugs that we actually detect and test for, we look for the presence of metabolites. So a metabolite is a substance which is produced by the body when a drug is ingested. So when the body is breaking down that drug to actually eliminate it from the body, it produces other substances, and these substances are called metabolites. So the presence of a metabolite confirms actual use of the drug, and we use that in our interpretation. So when we do a test, you don't actually have to ask for the presence of the metabolites. We automatically look that and include that within the analysis that we do. Okay, so there's some potential influences on detecting the compounds in hair. So the first of all is bleach and hair dye. So any sort of chemical hair treatment to the hair that can actually damage the hair can reduce the level of compounds that would be present in the hair. So we can still test hair which is being bleached or chemically treated through hair dye, but the actual level that we expect to see would be lower than if the individual hadn't administered or used such treatments. So if somebody was a regular user of drugs and they did bleach or dye the hair, then the level we would detect would be lower, but we can still detect it. At the time of sample collection, we do ask the donor to declare any products or treatments that they've applied to the hair. So then they've got the opportunity, and then we use that declaration in our report, and it helps us interpret the level of drugs or the results that we actually have. But we also make our own observations in the laboratory when the hair sample comes in. So the first observation we make is we look at the hair before we start the analysis. And if we identify that there's a color change along the length of the hair, then that could indicate that the hair has been dyed or bleached. So then we make that observation into the report as well for your reference. But also during the actual extraction process, if the color of the solution changes, that gives an indication that hair dye is present. So therefore, we would also then make that observation in our report, and we can use that observation in our interpretation of those results. Passive smoking, external contamination. So this is a very common question that I get asked around. My client was at a party, people were smoking cannabis. Could this give or explain the positive cannabis result that has been detected in my client's hair sample? Well, we have 3 measures in place to prevent a positive result from passive smoking or external contamination. The first is that we wash every single hair sample prior to analysis, so that removes any traces of hair of drug on the outside of the hair. So what we're analyzing is what has actually been ingested into the body and incorporated into the hair itself. The second is that we look for the presence of the metabolites. So you only get the metabolites if a drug has been ingested and incorporated into the body. And then thirdly, the cutoff level that we apply is there to show the repeated use of a drug, and you'd only get that from the repeated, you'd only get a result above the cutoff from that repeated use. So from being in an environment of passive exposure, external contamination, from a smokable drug such as cannabis being present in the atmosphere, that wouldn't be expected to go into the body at levels above that cutoff level to therefore provide a positive result. Okay, medication. I've already covered medication to some extent. Medication would not give a false positive for any of the illegal compounds that we're looking for. So if we find heroin, it's heroin. If we find cocaine, it's cocaine. If we find cannabis, it's cannabis. So the medication wouldn't give a false positive result. We do ask the donor at the time of the sample collection to declare any medication that they've been using. So therefore, we can take this into consideration into our in our interpretation of the results, and actually state that this medication would not give a positive result for that actual compound. But for example, if somebody was taking codeine, and you can buy codeine over the counter, or it can be administered from a GP or a medical practitioner, then, and we find codeine in the hair, then we would actually state codeine has been declared, codeine has been detected in the hair sample, therefore the declared use of codeine could account for the codeine detected in the individual's hair sample. And the concentration and the purity of the drug taken. So there's no pharmaceutical or regulatory controls on how illegal substances are produced. So the purity and the concentration of the drug can actually vary. So we wouldn't be able to comment on the purity of the drug. So that's just something to be aware of when we actually provide the results, we're talking about the level which is actually found in the hair sample itself, and we can state whether we feel that's a low, medium, or high level in comparison of other tests that we've done for the 12 or more years that we've actually been analysing hair samples and built up a database of positive results. Okay. So moving on to alcohol testing. First of all, I'll start with the hair test. So with the hair alcohol test, what we're looking for are two markers of alcohol use that are produced by the body when alcohol is ingested. So this is ETG and ETPA. So when alcohol is ingested, the body breaks down alcohol and it produces these two markers, ETG and ETPA. So the presence of these markers in hair can be used to help assess chronic excessive alcohol consumption. And that's a really important point, is that the hair test is there to show chronic alcohol use. So chronic alcohol use is defined as 60 grams of alcohol or 7.5 units of alcohol every day covered by the period of time of that hair test. So that could be 3 months, 4 months, 5 months, 6 months. If it's not detected result, we're not saying that the individual hasn't consumed alcohol. What we're saying is that there isn't evidence of chronic excessive alcohol use. So that's an important point to take away from this today's seminar, what the hair test can actually provide. So 7.5 units of alcohol equates to about a bottle of wine or 4 cans of regular strength lager on a daily basis, covered by that 3-month or 6-month period of time. So 7.5 units of alcohol a day corresponds to 52.5 units over the course of a week. So an individual could abstain from alcohol for the beginning of the week, say Monday, Tuesday, Wednesday, but then consume 52.5 units from Thursday through to Sunday. If they were doing that on a weekly basis, i.e. every single week for their 3-month period, then that would be expected to give a level equivalent to chronic excessive alcohol. Now, in terms of the time period that we can go with alcohol test, it's a maximum of 6 months, and that's due to the stability of the hair alcohol markers in hair after 6 months. So with drug testing, we can go back as long as the hair allows, but with alcohol testing, it's just the past 6 months as a maximum time period. As I said, body hair, that's only from the chest, forearm or leg regions, and the test that we do is in accordance with the Society of Hair Testing Consensus, as Sammy said at the beginning of the presentation. It is recommended that the hair alcohol test is used in conjunction with other tests, such as the blood tests. So that's because the hair alcohol test is going back historically over the past 3-6 months typically, but it won't capture the first 2 weeks, whereas the blood test will really give you an indication of more recent alcohol consumption, generally of the past 2 to 4 weeks. So it's covering a different time period than the hair alcohol test. So we offer 3 tests, CDT, which is carbohydrate deficient transferrin, liver function, and phosphatidylethanol ethanol testing, which is PEth testing. So the CDT and the PEth tests are the better out of the 3 tests, really, because they're actually alcohol specific and actually looking for alcohol, they're direct metabolites of alcohol. So it's an alcohol specific test, and it's really looking at the past 2 to 4 week period. The liver function test isn't alcohol specific, so other factors such as medication, health conditions, that can affect liver function. So the liver function test is really a corroborative test and can really be used to help build up an indication of chronic alcohol consumption over a period of time. Now you can get different results with the hair test and the blood test, and that's not saying that one test is wrong and the other test is right. It's just that they're 2 very different tests covering, and they're independent tests covering different time periods. So it could be that the hair test, for example, is positive, showing chronic excessive alcohol consumption, but more recently the blood test is negative. So that could indicate that more recently they're not consuming chronic levels of alcohol. So it's really useful to show kind of different time periods. Okay, so the blood and the hair is very good at going back retrospectively in time. SCRAM is very good at monitoring alcohol consumption on an ongoing basis. So SCRAM stands for Secure Continuous Remote Alcohol Monitoring, and it's a device which is worn on the ankle, and it tests for alcohol every 30 minutes of every day that the device is worn. So SCRAM tests for alcohol which is present in the sweat or perspiration of the individual. So when an individual consumes alcohol, the majority of the alcohol is excreted from the body via urine, but 1% of the alcohol is excreted from the body across the skin via perspiration and sweat. And the SCRAM device is testing that sweat for the presence of alcohol. And it takes a reading every 30 minutes of every day. So it's really useful for showing a trend or monitoring alcohol consumption subsequent to the bracelet, the device being fitted. So the device is fitted to the ankle and it's worn continuously. And then it syncs wirelessly to a base station, which is set up in the participant's home via Wi-Fi connection, and it syncs wirelessly twice a day, and it downloads the readings from the SCRAM bracelet. The base station unit then sends that information through to us, and then we can then look at those results and then prepare a report on those results every 30 days, typically, that the SCRAM bracelet is worn. So this is to give you an indication of the sort of results and reports that you will get from the SCRAM bracelet. So if you look at the top graph, for example, this is really indicative of consumed alcohol. So we can see the black line, so that's the alcohol reading taken from the SCRAM device, and we can see that it's we've got some very nice peaks there. So that's indicative of alcohol consumption on a daily basis. The red line is the temperature. So that's showing that the temperature is increasing and decreasing. And then the blue line is the infrared distance beam. So this is a beam which is used to help monitor or track and identify any instances of obstruction or tampering with the device. So the infrared beam measures the distance between the device and the ankle. If anything is placed between the ankle and the bracelet to then block that beam, then that triggers a confirmed obstruction or tampering event, and then we'll include those events in the report that we provide every 30 days. Then if we look at the bottom graph, you can see that there's a slight, on the blue line, for example, we can see that there's a slight disturbance of that, so that could indicate that that's a tampering event. But if we look at the black line, which is indicative of the alcohol readings that we've taken, we can see that they're just very straight lines. So what this would mean, this would indicate environmental alcohol exposure. So the SCRAM device is detecting alcohol external to the body as opposed to alcohol being absorbed and eliminated from the body. So this could be the individual using products containing alcohol, such as fragrances, moisturizers, for example, or working in environments where there's a lot of alcohol present, such as bars, restaurants, that sort of environment. So we can really tell the difference between consumed alcohol and environmental alcohol consumption, and our reports would actually explain that. Okay. So moving on to the sample collection quickly then. So as Sammy said at the beginning, sample collection appointments can be arranged immediately and usually collected within 48 hours notice, and we can collect hair and blood during the same collection appointment. For a SCRAM device fitting, that generally lasts a lot longer. So that could be, so we would need to book quite a longer time slot for that fitting.
It's about an hour to an hour and a half for a SCRAM compared to 30 minutes for a hair strand or 40 for a hair and blood test.
Okay, great. Thanks, Sammy. The donor has to provide a photographic ID at the time of sample collection so that we can verify the identity of the donor. However, if they don't have photographic ID, we do take a photograph and include that in the report so that their identity can be verified at that point. The sample pack forms the full chain of custody regarding access to that sample for the whole procedure, so it's fully audited. And our trained collectors ensure that sufficient sample is taken for the analysis. And then the hair samples are stored at our laboratory for further analysis if required. That's whether if we need to go back slightly longer or to undertake testing for other drug groups. Then in respect of reporting the results, we either provide a certificate of analysis or a full expert report. The full expert reports will really provide a full interpretation of those results, and us as experts will therefore give our opinion on what those results mean to help you kind of put them at the analytical level into perspective. And as we're experts, we can then go to court and give evidence on those results if needed. If further clarification on that report is required, or if there's additional questions or further evidence comes to light, such as the donor has identified that there's other medication that they've taken, or they've applied other hair treatments that weren't declared at the time of the sample collection, then that can be emailed through to us. We'll then consider that and then provide a response back and state whether that may change our interpretation of the results or not. Okay. And as Sammy said, there's multiple ways in which you can instruct us to undertake that testing. So I'll now open up the floor to any questions. Kate, I understand you're on the call. If you could take everybody off mute, please. Okay, so thank you for your time this afternoon. Does anybody have any questions for either myself or Sammy today? You can either use the chat facility or just or speak out. I think you should have been taken off mute by now. No? Okay. If you do have any questions, you can always email Sammy after the event, after today, and either Sammy can help, or you can email myself, or Sammy can forward your email on to me, and I can answer those questions for you.
No questions? Okay. No? There's one thing I wanted to add just regarding the SCRAM testing. With regards to the reporting frequency, we can do them every 30 days, but we can also do them fortnightly or weekly at an additional charge. So the option is there for you to decide how often you would like the reports, but we can do them as frequently as every week.
Okay, great. Thanks.
Did notice some people were typing, but I haven't seen anything come through. Maybe we should just wait a second just in case.
Sure. Okay. Can you go over the effect of passive results? Okay. Is that in relation to a result from passive exposure? Yes, okay. So in respect of passive exposure, we wouldn't expect to have a result above the cutoff level for passive exposure. That's because the cutoff level that we apply is there to show the repeated use of that drug. So with passive exposure, the amount of drug to actually be detected would be expected to be really, really low, because if it's in the atmosphere, for example, the amount being ingested and incorporated into the hair would be low and wouldn't be expected to be above that cutoff. Now, if an individual was in a confined environment on a regular and frequent basis, then it is possible that we could get a positive result from that, but it would be expected to be at a really low level. But it would have to be the regular and frequent exposure in a very confined environment for them to inhale and ingest enough of the drug to then actually go into the hair above that cutoff. And it would really have to be a compound which would be present in the atmosphere. So such smokable drugs such as cannabis, possibly crack cocaine. Heroin can be smoked, but it would have to be a confined environment. In terms of solid drugs going into the hair kind of passively or externally, they would have to be physically rubbed into the hair, and the hair would have to actually come into contact with that drug and be rubbed into the hair, as opposed to somebody taking a drug, a solid drug such as cocaine powder, in the same room. In those instances, the hair would have to come into contact with the drug in excuse me, to some extent for it to then actually be absorbed through the hair. I hope that answers those questions. Okay, great. Thank you. Thank you, Phyllis. And if any of those kind of scenarios are explained, or your client does describe those scenarios of the sort of environments that they are present in, you can, excuse me, you can submit that scenario to us for our experts to then consider the details of that scenario, and then we'll state whether we think that's a possibility or not. And then we could prepare a response back. So we do receive queries with donors explaining such scenarios for our experts to consider. Okay. Okay, great. Thank you. Are there any other questions before we draw today's session to a close?
I think somebody's typing. Oh, no, just a thank you.
Okay. Okay, that's great. Okay, well, thank you ever so much, everybody, for your time this afternoon. Well, this morning even, sorry. Enjoy the rest of your day. We'll share the recording of today's event with you just for your own reference. And please do get in touch with us if you have any other questions at a later stage. Okay, thank you ever so much.
Thank you, everybody.
Thank
Have a
you.
lovely day.
Thanks.